Well, 7:05.
Getting together with friends, going to the park for a picnic without needing to mask up. We're back to that place now as long as you get vaccinated.
So for those who are fully vaccinated, the CDC now says it is safe to be outdoors and indoors in small gatherings without a mask so long as others are fully vaccinated as well.
Let's talk about Philly. Officials in our city are also easing more restrictions as COVID-19 cases, the numbers are falling and more people are getting vaccinated, or are they?
So let's bring in Philadelphia Health Commissioner Dr. Farley, who's joining us now. Good morning to you.
Good morning.
So I guess we have to start with this new mask guidance from the CDC. Seems like there's, new rules. But the thing is, don't you still have to carry your mask? Because even if you don't have to wear it when you're outside, you'll still need it whenever you go inside.
Right. You need to have your mask with you at all times. If you're outside, not near anybody, you don't need to wear a mask. Or if you're outside and you're vaccinated and you're around even a small group of people who are vaccinated, you don't need to wear a mask.
Hey,
not a big change,
yeah.
But it's progress.
Yeah, it's progress. How about kids who have not been vaccinated? Can they run around without a mask on?
If they're outside, that's okay. If they're inside, they should be wearing a mask.
Okay. If you are fully vaccinated and you're around folks who are not vaccinated, do you have to wear a mask then?
Yes, you do. There's some risk that you could conceivably pass it on to them, and some risk that your vaccine didn't work and they could pass it on to you.
Okay, let's talk more about restaurants and stuff like that. What are new restrictions or new easing restrictions?
Right, we're easing restrictions. Currently in Philadelphia, we're more restrictive than the state of Pennsylvania, where restaurants are no more than 25% capacity or 50% if they have extra ventilation. Now we're going to increase that as of May 7th to 50% for all restaurants and 75% if they meet our enhanced ventilation standards.
Okay. Let's talk about the shots, Alex.
Yes. So we've been passing along the news that if enough people don't go up and get their shot, then 4,000 vaccines are just going to expire at the convention center.
Yeah, so we use vaccine there that's in ultra cold storage, minus 70 degrees. When you thaw it out, you have about 5 days to use it. And there have been fewer people coming to the convention center than we had planned, and so we have extra doses. We're going to move some of those around to other providers around the city to use it. But the bigger message is that vaccination is easier than ever to get. Go to the convention center, go to your local pharmacy, go to other healthcare providers. Get vaccinated now.
So you're saying they're not going to just go away? Because I guess when we say expire, which is the messaging that we receive, that it's going to be thrown away. So you are going to find a way to make sure they don't go to waste.
I'm not convinced we're going to be able to use all of them. We're going to use as many as we can by moving them around to other providers.
So moving them around, but you're going to have to do that today, right?
Yeah, we're going to have to do it in the next couple of days.
The next couple of days, because we keep saying this, that they're all going to expire tomorrow.
I don't have the exact date with me. I know it's coming up soon.
Okay. Is there a plan then, since we're noticing that fewer people are going to the convention center, yet we still don't have herd immunity, because that would be, 70 or almost 80% of folks getting vaccinated. Is there a plan to try and get more people to come?
We're in this now phase 2 of this, where vaccinations now are readily available, easily available. And the people who are vaccinated are the people who are maybe ambivalent, maybe they're very busy. So it's going to be kind of a slow, steady use of pickup of people who are unvaccinated. And so we're just going to have to encourage as many people as possible to get vaccinated. We want it to be a high percentage because that'll protect all of us.
Okay, I have so many more questions here real quickly. Here's a message from one of our viewers. Could you ask Dr. Farley why they can't distribute some of these vaccines to primary care physicians? Just do it at the doctor's office. Like my doctor is Dr. Mike. Why can't he have some at his office and I just go by and get in the arm?
We are distributing it to some small offices. It's a lot harder because they don't necessarily have the storage or the data capabilities. But there are some now, an increasing number over time.
Why in the heck aren't people over 55 getting the vaccine? They're the most vulnerable.
Most people are, but there's still some that aren't. And all I can say is, please get vaccinated now. If you want to go to a restaurant, if you want to have those weddings, now's the time to do it.
Has it ever been talked about having a drive up somewhere in the city so folks don't have to get out and park and find, because some people are tweeting us saying, well, it's hard to get to the convention center. Has that ever been? I know it's hard for space-wise.
We talked about it at the link, and I don't know whatever happened to that.
You know, the large vaccination sites played a role when we had a huge demand. The convention center was great. Large drive-through site now, I think, would probably not get that many people. There's lots of opportunities in every county for people to be vaccinated, particularly at pharmacies. You know, there's pharmacies almost everywhere, and almost all of them now have vaccine.
They sure do. The one down here at 3rd and Market has it. Big sign. Dr. Farley, thank you. We'll keep checking with you.
Okay, thank you.
You got it. 7:10 now.